Evening and welcome once again. Today is our 1240th day of uninterrupted webinar. Today our guest is Dr. KULWANT SINGH. He is MD in Homeopathy from GD Memorial Homeopathy College, Patna, and worked as a faculty of homeopathy in Vinoba Baba University, Jharkhand, and principal in Singham Homeopathic Medical College Hospital, Jamshedpur since 2000. Professor worked as a professor in SHM College, Jamshedpur, and presented several seminars in India and outside, and presented some papers in Arab Health Congress, Dubai on 2014, and he worked as a resource person for seminars in the Ministry of Ayush at Vigan Bhavan, New Delhi, and a resource person of seminars in homeopathy of homeopathy by Central Council of Homeopathy, and resource person in all CCS workshops in India, and presented several seminars at Ranchi, Patna, Kanyakumari, Trivandrum, Goa, and ex-chairman of Homeopathy Literature Committee in Central Council of Homeopathy, ex-member of Educational Committee, Central Council of Homeopathy, and PG guide of Muzaffarpur in Bihar, and ex-inspector of Central Council of Homeopathy, New Delhi, examiner and paper setter for several universities. And today's our topic is benign prostatic hyperplasia and homeopathy. Dr. KULWANT SINGH, you are welcome to our webinar, please.
Can I share my screen?
Sir?
Can I share my screen now?
Yeah, but now it's clear. You can share, you are not the... Yeah. Now I made you as a co-host, you can share the slides. I thought Dr. Sahani sir already made you as a co-host. So, sorry.
Anyway, thank you so much. Welcome all again. And my sincere thanks to the organizers, office bearers, and members of IFPH. And I'm thankful that they have again given me a chance to speak on benign prostatic hyperplasia. In the first part, we will discuss the different aspects, causes, symptoms, clinical investigations of benign prostatic hyperplasia. And in the next part, we will discuss in detail the homeopathic management and treatment of this. As far as the history goes, Indian were very advanced in diagnosis of this prostatic problem, and we all have heard the name of Sushruta. There is Ayurvedic books named as Sushruta Sanghita. So these are the books, old, very ancient books.
Sir, can you, the sound is very feeble.
Okay. Is it, hello?
Sir, please.
Is it better now?
Yeah, better.
Thank you. So, as we know, this Sushruta Sanghita has everything, and in ancient times also, Sushruta explained the prostate gland, not in the name of prostate gland, but he explained as the prostate gland that it is a place between rectum and bladder is occupied by vitiated vata. You know, in Ayurvedic, Vata, Pitta, Kapha, these three things are very important. So he explained this as a Vata, and he explained this prostate gland as Ashtila. Ashtila was a stone, very strong, very hard stone, being used in those times to sharpen the weapons. It was used to sharpen the weapon. It was such a strong stone, and that was called as prostate gland, was known as Astashila. It was very clear in their mind since beginning that this is a thing which is very hard, very strong, and may play a very important role in case of genitourinary tract. In other case, Yoganta Ratnakara, they have also explained and they have also named this as Astashila. Astila. So this both were similar in diagnosing these cases. So means below umbilicus, there is a hard gland which is a little bit bulged and changes its place sometimes and sometimes stays stationary. These are the understanding those times. And Astila was a small stone used to sharpen swords. This gland, when affected by Vat, causes a disease called Vatashila. So this Vatashila was later diagnosed as or named as benign prostatic hypertrophy. So what I mean to say is that we were very sure, Ayurveda was very sure of the presence of a gland between the bladder and the urethra. In old times, Hippocrates, we know, father of medicine, Hippocrates also diagnosed this as a case of round body or circle and recognized its role in causing urinary symptoms. Hippocrates associated urinary difficulties in older men with the enlargement of this gland. So Hippocrates was also able to understand that these are the things, this is the gland which can cause problems in the urinary tract and the placement of the gland. After Hippocrates and Galen were contemporaries, Hippocrates was senior to Galen, but Galen was master of anatomy. Some people say that he was the god of anatomy. So he also referred to prostate gland as Harnaios, describing its relationship urine and semen. Galen believed that the prostate played a role in generating semen and contributed to male sexual function. And later on, we knew that generation of semen or sperm was the case of testis, but prostatic fluid played one of the most important role in the genitourinary tract. So it is a reddish brown, size of an English walnut. So walnut, it is in the size of a walnut. Prostate is a gland which contributes greatly to one's sexual life. It is the principal storage depot for the seminal fluid, without which chances of pregnancy will be about zero. Why? Because seminal fluid, prostatic fluid mixes with the seminal fluid, mixes with the sperm, goes into the vagina, and it neutralizes the acidity of the vaginal tract so that sperm can move on. If this acidity is not neutralized, the sperm will not move and they will die in the cervical or vaginal canal. So this is one of the most important role of the prostate gland, that it neutralizes the acidity. At each ejaculation, testicles provide about over 150 to 200 million sperms. Prostate produces a fluid that dilutes them, and this fluid containing protein, enzymes, fat, sugar, nourished the fragile sperm. Alkalinity to overcome the deadly acidity of the female tract. Please remember this. What prostate is doing? We are very worried. There is a prostate gland, there is enlargement of prostate gland. There are so many complications of prostate gland, but the basic function of the prostate gland is to neutralize the acidity in the female tract. Then only the sperms can move freely inside the vaginal canal and may go to the fallopian tube and further for the fertilization. So this is the most important part of the prostate gland. This is the urinary bladder. Below this, these are the gland, the green color. This is the prostate gland, which covers a part of urethra. This is the bladder. This is the urethra. From here, urine comes out. But this part, the big part of the urethra, is covered by prostatic gland in the round like this. If this is the urethra, this is the prostate gland. It covers, rounds up the prostate urethra. And this urethra is known as prostatic urethra. This part of the urethra is known as prostatic urethra. We will discuss later on that as the prostate changes its size, it enlarges to some extent, sometimes equally, sometimes not equally. So due to the pressure of the enlarged prostate on the urethra, there are so many complications. Sometimes this prostate may go inside the bladder. It may project inside the bladder. If it projects inside the bladder, there are different symptoms. If it compresses the urethra, there are different symptoms. If it stops the urethra, there are different set of symptoms. So one small gland, if enlarges, can create so many problems. We will discuss step by step. The prostate is located between the bladder and the rectum. You can see prostate is situated in the, this is the, you can see, this is the bladder. Just below the bladder, this structure is the prostate gland, and this is the rectum. This is the anal canal. So from anal canal, this prostate is very near. And when this prostate enlarges, when there is hyperplasia of this prostate gland, it enlarges like this, and we can feel the prostate from the rectal examination, digital rectal examination, which is known as DRE. One of the easiest and most common process to diagnose the enlargement of the prostate. You have the glove, put your finger inside, and you can feel the enlarged prostate from here. It is only 4 centimeters. It's not very long distance, but due to this enlargement, you can feel from here, and by the shape, by the smoothness, by the irregular shape, you can diagnose that whether it can be simple benign prostatic enlargement or it is maybe a case of prostatic cancer. I told you that you can see this is the bladder, this is the urethra, and in the urethra, this ring-like structure. This is a ring. This is covering whole of the urethra, and this is the prostate gland. Of course, this is a diagrammatic representation, but this will clear the doubt that where is the prostate and how it looks. So it covers the entire urethra like a round ring. So if there is enlargement in this prostate gland, this is the prostate gland. We have taken this picture from here. So this is the enlargement of the prostate gland. And if there is enlargement, you can see some deformity in the urethra. So this part is prostatic urethra. And due to the undue pressure of the prostatic urethra, the smoothness of the prostatic part may change and there are complications. We will come to that. I think it is clear. The prostate has two main functions. It produces a fluid which contributes nutrients and to sperm and converts testosterone to, it is very important function, that is it converts testosterone to the more powerful male hormone, that is DHT, dihydrotestosterone. Please remember, the male hormone is known as testosterone, but male hormone testosterone is not active unless or until it is converted into active form, that is dihydrotestosterone. And this conversion takes place by an enzyme that is known as 5-alpha reductase. Please remember this word, 5-alpha reductase. Because if there is no 5-alpha reductase or less 5-alpha reductase, less testosterone will be converted into dihydrotestosterone and it will not cause prostatic enlargement. Nowadays, or the modern medicines are giving on the basis of this theory only. One of the theory is this, that they reduce the formation of 5-alpha reductase, the enzyme which can convert the testosterone to active dihydrotestosterone. And there are only 2 medicines in homeopathy in which it is clearly written. One is sabal-ferulatum. That is why you must be listening or hearing that sabal-ferulata is the medicine which is the most common, most intimate, and universally applied medicine in allopath, in homeopath, in Ayurveda, all other medicines. The common name of sabal-ferulata is saw palmetto. You go to the internet, try to find out saw palmetto. There are saw palmetto tincture, saw palmetto capsules, saw palmetto tablets, any branch of medication. That is why I am telling that saw palmetto or sabal-ferulata is having an action on 5-alpha reductase. And that is why it is helping to reduce the prostate enlargement. And there is one more medicine which is not proved in homeopathy, but it is being researched very nicely by other branch of medications, and it is very profoundly used in African country Ghana. I will teach this when I will come to the medical part, medicine part, but there is a plant which directly acts on the benign hypertrophic polyp, and it has been proved clinically now that it reduces the 5-alpha reductase. I'll give you the name also, but these two are the only medicines pathologically, physiopathologically, which are proven product of reducing the 5-alpha reductase. And that is why these are very successful. And see what happens in prostate enlargement. This is bladder, there is urine, it is passing very freely. It is passing, this is the structure of the urinary system. What happens as the age advances? After certainly 45, 50 years of age, what happens? The amount of testosterone, male hormone in the body, reduces. Testosterone is at its peak at the adolescence. Adolescence time is the place when testosterone levels are at its peak. And as the age advances, the testosterone level starts reducing. And they cannot make the proper balance between estrogen and testosterone. What happens? Normally, estrogen levels are very low, testosterone levels are high in case of male. But due to the advancement of age, this level getting disturbed. So suppose testosterone level is 100, estrogen level is 10, so the proportion is 10:1. But later on, as the age advances, what happens? The estrogen level remains the same. It is 10. But testosterone level reduces. So from 100, it may come to 50. So now the proportion will be 5:1. So that proportion between testosterone and estrogen are disturbed as the age advances. And the prostate cells, what will they try to do? Two things. One, testicular cells. They will try to make more testosterone, including the prostatic cells. And second, they will try to increase the number of cells. So even if the secretion is less, if the cell division is there, if the cells are increasing, the testosterone level will be balanced. You can see these are the cells, and you will gradually, minutely see, you will see that the cells are increasing in size and the cells are dividing also. These cells are overworking and these cells are increasing the size. Okay, you see, this is multiplying. They are multiplying in size. They are multiplying. So they are increasing in size and they are working hard. Due to this, there is enlargement of these cells. And if there is enlargement of these cells, that is prostatic hyperplasia. I think it is clear to all of you now that due to the less testosterone level, the cells try to work more. They work hard in two methods. One, they increase the size of cell. One, they increase the number of cells. And in both cases, when the size increases, when the number increases, there is enlargement of the cells. So there is enlargement of the cells, and that is nothing but prostatic hyperplasia. See, this is a normal, this is the prostate gland. This is a normal prostate gland. This is the bladder. You will see what happens in normal condition. Urine is formed and urine is flowing freely from the urethra. This is the urethra. There is no problem in the urethra. So this is the normal condition. And in condition when there is enlargement of prostate gland, so it is giving pressure on this area. And where there is pressure on this area, what will happen? You will see the water will be, urine will be blocked here. It will not pass freely. Just see. There is constriction, severe constriction, and the urine is being blocked. It is not passing. It is blocked here. So whenever there is a prostatic hyperplasia, when there is enlargement of the prostate gland here, it will give pressure on the urethra, and this urethra will not allow the urine to pass, and there will be severe retention of the urine in the urinary bladder. And these are the 4 or 5 steps which will very clearly show you that what will be the symptomatology of the benign prostatic hyperplasia. If there is blockage here, if there is pressure here, if there is pressure here, and if there is retention of urine, accumulation of urine. Retention of urine will be when this will be blocked. And this is post-void urine. This volume will increase, and as there will be increased volume and giving pressure on the part, this will be giving pressure on the part, this part, there will be pressure. If this part will be getting pressure, what will happen? Patient will feel that he will have to urinate so many times. Sometimes the urine will not pass properly. Sometimes due to pressure, he will not be able to control it properly. Sometimes there will be pain in the bladder area. Sometimes if there is more and more urine congestion here, it will become a breeding ground for bacteria. Urine is toxic. It should come out from the body. If it is not coming out, it is retaining in the bladder. That will become a very, very good ground of growth of bacteria. And the bacteria will grow freely, and the patient will be having regular urinary tract infection. This is the bladder. This is the prostate. This is the urinary bladder. This is the prostate. These are the sagittal view. These are the posterior view from the. So whenever there is problem, you can see this bladder muscles are not smooth. They are trabeculated. There is a trabeculation. Why this trabeculation is happening in these muscles? Normally these muscles are smooth, detrusor muscles. These are known as detrusor muscles. So detrusor muscles are very smooth, but due to long-standing pressure, because of there is some blockage here due to the pressure of the prostate gland, there is some blockage here. So due to this blockage, what will happen? The bladder will have to exert pressure, and gradually the smooth muscles, they become trabeculated. So trabeculation of the urinary bladder muscles is a great sign or indication that there is some obstruction in the urinary passage, due to which the urinary bladder has to press a lot. And nowadays, the latest division of the prostate gland is on the basis of zones. Previously, it was on the basis of lobes, that there are different lobes in the prostate gland. I will show you that, but nowadays we divide this as per the zones. You see, this is the prostate gland. This is the prostate gland. This is the urethra. This is the urethra. So this prostate gland is covering the entire, this is entire urethra. You can see here. So what is that? So it is divided into 4 zones. The anterior zone, which is based anteriorly, this is the total prostate gland, and the anterior part is known as anterior zone. Peripheral part, the covering peripheral part, this is the, you can see this peripheral area, this complete periphery, green color, this complete periphery of the prostate gland is known as peripheral zone. This is the central part, the bluish part, this is the central zone. In this case, you can see this is the central zone. And the most important part as far as BPH, benign prostatic hyperplasia, is concerned is transitional zone. Transitional zone is the part of the urethra. Here it is being shown in the yellow color. You can see it is closest to prostatic urethra. I repeat, transitional zone, transitional part of the prostate, this is the entire prostate gland. But the transitional part is known, transitional zone is known, which is the closest with prostatic part of the urethra. Now, it is very simple to understand that what will be the zone, what will the problem which will directly affect the urethra and further the bladder. Obviously, that is transitional zone. So any problem in transitional zone will directly affect the urethra and urethral activity. Urethra, sphincter, bladder. All these activities will be directly affected if there is any problem in the transitional zone. But if there is a problem in peripheral zone, it is not affecting the flow. So what happens? Please try to understand this, that benign prostatic hypertrophy takes place in the transitional zone. Prostate carcinoma takes place in the peripheral and other zones. So in case of carcinoma of the prostate, for a very, very long time, you will not have any symptoms. There is no urinary problem because it is not giving any pressure. This is not giving any pressure on the prostatic part of the urethra. But in case of transitional zone, in this zone, even if slight enlargement is there, slight growth of this part is there, it will directly act on the prostatic part of the urethra and create symptoms. So I repeat once again, sir, that transitional zone is the zone which is the most susceptible zone where enlargement of the prostate takes. Enlargement to sabhi jagah, it is all over, but this is the place which will directly affect the prostatic part of the urethra. Anterior zone, peripheral zone, which is the most common site for prostatic carcinoma, it does not affect directly the, unless and until it increases. Until it becomes very severe, so that it can affect these parts, then there will be severe problems. But in the beginning, the starting of the enlargement of the gland in the transitional zone will start creating symptoms of benign prostatic hyperplasia, the complications of benign prostatic hyperplasia. That will be very clear. Every doctor can understand if there is pressure here, there will be difficult urination, difficult stoppage of urination, there will be frequent urination, there will be involuntary urination. If there is problem in the sphincter, if a sphincter is not working properly, involuntary frequent urination. If there is accumulation of urine due to stoppage here, due to the blockage of pressure here, there will be congestion of urine in the urinary bladder. There will be infection, and this infection may be ascending in nature. Normally, urinary tract infection, we say that it is descending in nature. But in this case, it will be ascending in nature. The infection will travel from the bladder to the kidney. And there may be, if there is blockage here, there may be hydronephrosis also. Due to the congestion of urine in the bladder, it will go up, there will be back pressure, and due to the back pressure, there will be hydronephrosis. So all these complications will be present in different intensity in case of a prostatic enlargement. You can see, just watch this, it will make more clear. This is the seminal vesicle, prostatic urethra is there. Transitional zone, this is covering the prostatic urethra. I see nothing better picture than this. Central zone, it is there, but it is having some distance from the prostatic urethra. And peripheral zone, it is covering the outside only. So the part which is nearer to this is, you can see in the next picture, these I was telling lobes of prostatic gland. The lobe of prostate glands are there. Nowadays, this practice is not very common. So these are lobes. We can say the anterior part is having anterior lobe. The median part is having median lobe. The posterior part is having posterior lobe. So these are the different lobes of the prostate, which were divided now as different zones. So there is different zone. And one more thing is important, that is, there are lobes of prostatic gland. So prostate gland is covered by a capsule. Prostate gland is covered by a capsule, which is known as true capsule. And above the true capsule, there is again a capsule, which is known as false capsule, which is very important for the practice and surgical part. It is very important because between the true cover and a false cover, there is a severe supply of the veins. There is venous plexus. So during surgery or during accident, if there is any injury to this part will bleed extensively and it will be very dangerous. Extensive bleeding, which cannot be controlled. Sometimes this is written in the reports also. So now come to the theories of prostate. So theories of prostate, as far as theories are described, so there are two theories. One is harmonic theory. The harmonic theory, as age advances, male hormone diminishes while estrogenic hormone does not. So tissues are enlarged due to predominance of estrogenic hormone. This is involuntary hyperplasia, like fibroadenoma of the breast. This I have already explained. I don't need to explain this, that there is imbalance between these two parts. And these two parts, estrogen and testosterone, the balance between two is getting disturbed. And due to this disturbance, there is prostatic enlargement. Testosterone level diminishes, estrogen level remains the same, but due to the imbalance, there is enlargement of the prostate gland. And second is neoplastic theory, that is benign neoplasm. It is composed of fibrous tissue, fibromyoadenoma, like the adenomas of the breast, which we know, which all know. So there is a theory So this theory is sometimes we can explain, yes, there is a hormone from the hypothalamus, there is a hormone pathway of prostate function. So there is a hormone that is known as LHRH, luteinizing hormone releasing hormone. So luteinizing hormone releasing hormone goes to anterior pituitary. Anterior pituitary, it help to release LH, luteinizing hormone. It goes to the testis, helps in the formation of testosterone. And this I was discussing regularly, that testosterone level is in the prostate gland, which is converted into DHT, dihydrotestosterone, the active part, by 5-alpha reductase. So 5-alpha reductase is having the most important role, and now modern medicines also are taking help of this. Now, let us summarize that what are the basic action part. So what happens? This is I have already explained all these things to you, but this is easy to understand that what happens in the urethra. Portion of urethra lying above the prostate gland becomes elongated and distorted. This part is the prostatic urethra. I have repeatedly told you that there is distortion of this part, and if this part is distorted, there will be difficult or different complications, like, as all of you understand, there may be less urine, there will be frequent urine, there may be stricture of urethra, there may be oliguria, there may be stoppage of urination, there will be total retention of urination. All these complications can happen due to the stoppage here, and you know the symptoms which will. And if there is stoppage here, there will be congestion in the bladder. What will happen? Musculature of bladder hypertrophies to overcome obstruction. That is trabeculation. The muscles of the bladder, they work overtime, and the shape, the smoothness of the bladder muscles goes off, and it become like Ricci things. So that is trabeculation. What will happen to the ureter and the kidney? I explained this, that there will be pressure on the ureteric orifice. This is the ureteric orifice. There is gradual dilation of ureter, hydronephrosis, ascending infection, nephritis. This is the orifice of the ureter. There will be pressure on these orifices. The urine will not pass from here. It will go back. It will create back pressure. And due to this back pressure, there will be hydronephrosis. And if it is a chronic one, then it may become, there is nephritis. And the sexual part, initially there will be increased desire. Due to the constant irritation in the urethra, there is increased desire of sex. But later on, as the testosterone level is diminishing, later there will be impotence. I hope this is very clear to all of you, that what are the effects of the small gland here, and how it can ruin, it can disturb the life of a male, aging male. A very simple formula is there. After 50, 60 years, 50% of male are having. After 70 years, 70% of males are having. After 80 years, almost 90% of males are having benign prostatic enlargement. So prevalent, so common problem in males. So now come to the clinical features. What will be the features clinically? So this, now I think I am able to explain everything. There will be sudden urge to urinate due to the constant pressure on the bladder neck. There is burning, painful urination due to the stricture of the urethra. What happens actually, practically, when the patient is regularly having desire to urinate, there is constant pressure, he drinks less water. And as he drinks less water, to avoid passing the urine, there is burning and painful urination. The patient is afraid to drink water. And if he drinks water, there is frequent urination during day or the night. Prostate patient will come to you that I am having frequent urination at night. Sometimes I can control, sometimes I can't. Because due to the stricture, there is a constant pressure on the urethra by the accumulating urine, and which causes sleepless nights for the patient. And as there is a stricture urethra, even after passing the urine, the patient is not satisfied. Patient feels that, oh, I have to go again. After urination, a sensation that the bladder is not empty. Inability to urinate, cause having less drink and due to stricture urethra. Prostate patients, aged patients, males, they will always say that I can't urinate while I am sitting. They will have to stand up, they will have to exert, they will have to pressurize, and then only they can pass it. And there are some good patients, because in case of prostate, you should not strain much. Patient should stand and wait. The urine will pass gradually. That is what a doctor should tell them. Don't overstrain, because when overstraining, the structure becomes more and the urine is blocked. So a prostate patient, they should not strain much. They should stand. They can wait for long, but let the urine pass gradually. That will relieve their complication. So, most common clinical feature is frequency. Patient has to go to the urinal regularly. Earliest symptoms in the first stage, it is nocturnal, and in the later, day and night both. Why nocturnal in the first stage? Because during the daytime, what happens? The patient is awake, patient is conscious, so he can pass urine. It is not troubling him much, but at night, when the bladder gets overloaded, he will have to rush. He can't control, he can't resist, he will have to rush. So many times, and many times it is involved. So this urgency is due to stretched vesical sphincter. I told you there's a tremendous pressure on the bladder sphincter. So this bladder sphincter getting stretched, and then there is urine. And as it is not able to control, there may be dribbling. Urine will come in drops. Patient will run, but it can't stop. Can't control. The patient will tell you that, doctor, when I feel like it, I am not able to control it, and there is constant dribbling. Feeling of something is remaining. The bladder is not clear. So these kind of symptomatology is present in case of. There is dysuria. One we have discussed. And second is dysuria, difficult urination. Patient must wait for urination to start, useless to strain. There is no benefit for straining. It is very difficult. Bladder contracts, can burst pain. I told you that he should not strain, because when the bladder contracts while straining, it will worsen the situation. It will aggravate the pain. And the stream is variable, weak, burning, tingling, stinging sensation. So now all the medicines are coming in your mind. Burning, tingling, stinging. So all doctors are thinking now, there is cancer, there is cannabis sativa, there is cannabis indica, there are other medicines which can help. Staphylococcus thuja, we will come to that. And sometimes there is inflamed or irritated urethra here. The urethra is constantly being tipped off, constantly being attacked by the bladder force to pass the urine, and gradually it becomes inflamed. We have good medicines for this. There may be pain due to cystitis or acute retention of urine. I have discussed. Retention with overflow, constant dribbling. What happens? if there is a retention, there is a pressure, there is a blockage here. So due to this blockage, there is flow of the urine retake stops, and there is constant accumulation of water here, urine here. So sometimes what happens, due to this overflow, this opens this passage for some time, and there is suddenly huge flow of urine. Then again it stops. Depends on person to person. Hematuria may be there, not very common. Renal insufficiency may be there, but not very common. These two symptoms are not very common. Hematuria will be when there will be severe urinary tract infection. This is what I was telling you, that there is BPH. This is the bladder, and these are the prostate gland. If there is no pressure, no reduction of this passage, there is no BPH. There is BPH, but big channel. You see, this channel is big, the enlargement is there, but enlargement is outside, not inside. This prostate is swelling, getting swelling outside, it is not giving pressure inside, so there is no problem. This passage is clear. But when there is benign prostatic hyperplasia, this gives pressure on the urethra, and this passage is being narrowed. So this condition is known as BPH. Nowadays, the latest nomenclature has come up, and we must be very, very well acquainted with this, because whenever you will see a prescription of patient of prostate gland, you will look the prescription, and the prescription will say there is BPH, there is BOO, and there is LUTS. This is very common. Please remember, whatever medicine you prescribe, whatever book you consult, but you must be aware of these words. And these words are LUTS. 90% of prescription of the hospitals will be having this written, that is lower urinary tract symptom. So what have they done? They have mixed, they have combined all the symptoms of the lower tract. Maybe it can be benign prostatic hyperplasia. It may be bladder outlet obstruction, BOO. You can see BOO, bladder outlet obstruction. Now this bladder outlet obstruction can be due to stones, can be due to prostate, can be due to stricture wisdom. But they have combined all these three groups, and they are telling now it is a case of BOO. Now you investigate why there is obstruction. But they are using this word very frequently. So there is BPH, benign prostatic hyperplasia, BPE, benign prostatic enlargement, and BOO, bladder outlet obstruction, and all these combined are known as LUTS, lower urinary tract symptom. And see,
Excuse me, sir.
Yeah.
Normally we will stop from 8:45 to 45, and we will use that 15 minutes for the questionnaire. I think now it is 50. Shall we go for the questionnaire,
my
or?
request that as this chapter is not finishing here.
Yeah, we will continue with the next class. I think that will
all
be
the
more
question
nice.
answers, I will keep some time for question answer in the next part.
Okay.
That will be better, no? Because this part will be
Okay.
ending.
Okay then. Okay, sir.
Then we can have discussion.
Okay.
I hope you will allow me now. Hello.
Yes, sir. You can continue. Continue.
Thank you so much. So there are three groups: LUTS, BPH, and BO. These three groups combinedly having this common space, and this common space is in BPH. The BPH will be having some symptoms, maximum symptoms of BPH, some part symptoms of BOO, and some symptoms of LUT. And combinedly, they are troubling the patient. And this I've already discussed that BOO, bladder outlet obstruction. There are obstructions, the causes I have discussed, the symptoms I have discussed. And what is LUTS is the lower urinary tract symptoms. See, this is a very important thing. There is a international prostate symptom score. You must have the knowledge because most of the hospitals depend on this. That is known as IPSS, International Prostate Symptom Score. The best way to understand this short form is known as FUN-WISE. F-U-N fun, W-I-S-E-Y. If you remember FUN-WISE, you can remember all symptoms of prostate hyperplasia. F is for frequency, U is for urgency, N is for nocturia, W is for weak stream, intermittent urine, straining for urination, emptying income. And there are points given to these, and according to these, the number of points, the patient is diagnosed whether this is a case of prostatic hyperplasia or not. So please remember FUN-WISE. FUN-WISE is the detailing of the symptom. This is internationally accepted. This is International Prostate Symptom Score, FUN-WISE. Now, as I have discussed, and how will we do the rectal examination? You can see, you just insert a finger. So insert the finger here. This is the prostate gland which is in. You can feel the enlargement of the gland in your finger. So but there are 2 points on this. One is that if the surface is smooth, the enlargement will be benign. But if the surface is irregular, tough, hard, then you can seriously think that this will be case of prostate cancer. Only one examination, not very highly advanced test. If the patient allows you, and if you have the experience, go for a DRE, digital rectal examination, which will confirm in your fingers that if the surface is smooth, it is benign. If the surface is hard, rough, then it will be. Now, initial evaluation, I told you, history is there, IPSS scoring is there, DRE is there, urine test is not very important. PSA test is important, but PSA test is not always confirmatory for enlargement or cancer. PSA is a test, prostatic antigen. So this prostatic synthetic antigen is the PSA test, can be done in the blood test, and blood test tells you that what is the score of PSA. Normally we say that 1 to 4 is absolutely normal, 4 to 10 is not dangerous, but if it goes above 10, then you should investigate the case properly. Abnormal PSA. Sometimes, not always, but sometimes if the PSA is increased more than normal, then this may lead to the abuse of prostate cancer. See, this is
Sir, I want to ask you, sir, I want to ask you something, a very serious one. I got 2 days back one case of cancer of the carcinoma of the prostate. The entire prostate gland was involved.
yes.
Yesterday, 2 days before I got this case, and it was in a serious condition, but the metastasis is in the lungs, small. In such a case, the entire prostate gland, the size of the prostate gland is 5 into 4.7 to 4.1, big one. So in such cases, I want to ask you whether is it possible for us to have a. Now he put catheter, and his 1 week or 2 weeks back, he is working in a radiology department, 56 years age.
That if he was catheterization was done, it means that the entire process or passage is already blocked.
Yeah, the creatinine level all are raised, and so that is why immediately they put catheterization.
I am more worried because of the metastasis to the lungs. Sometimes it happens that if the prostate is carcinomatous, then entire prostate tissue or prostate gland is removed and the patient can be given some life. But now this case is already switched to metastasis to lungs. So the it has gone to lungs. It is very, very serious, very alarming, and we cannot say that we can really help in this by homeopathy. Some symptomatic improvement can be there. But
he is very simple and he is very joyful and he is very active.
Okay, sir.
So,
It happens. Because that patient doesn't know now, because it is not in the transitional zone. When it flares up from the different zones to the transitional zone and start giving pressure on the urethra, it spreads into the urethra, causes stricture of urethra, the infection goes above, and that is why the serum creatinine is high. It means it is disturbing the kidney also. So situation is not good. It is spreading in the lungs, but when it will spread more and more in the lungs, then the patient will start having breathing problem and all that. Pain, breathing problem, and other difficulties. So as far as you explained, this case is very serious.
I took that case. He is not ready to go for chemotherapy and radiation or anything like that.
The patient is not ready to go for chemo. It is our duty to try to help. But in my experience of 45 years of practice, I have seen that at least I can say for myself that not much help can be given to these patients. But we must try. We are doctors, we are physicians. We must try according to our theory, according to our principles, according to our medicine. Sometimes we can help. Prostatic cancer can be helped.
Yeah, it is carcinoma of carcinoma of the prostate.
It has metastasis to lungs also.
Yeah.
So it is a lung carcinoma also now, no? It is a prostate carcinoma, it is a lung carcinoma, and it is a deficiency renal function. It may lead to kidney failure.
After that, done the this for catheter that is reduced. The condition is reduced. The other problems are.
You have removed the blockage. The urine is not stopping there. The urine is free flowing, but till when? Unless or until catheter is there, it is moving properly. But when you will remove the catheter, then what will happen? You will have to observe that. It is a temporary measure. And God bless the patient if he feels better.
Thank you, sir. You can say any some palliative methods if there is any palliation for to reduce the conditions.
Palliation in these cases, you have to have the complete case. You can have my email ID. You can please send me the all things, and I will 100% try my best to give you the medication.
Thank you, sir.
Okay.
PSMA, he done PSMA test and everything. Okay. Okay, sir, I shall send to you.
I think today's time is over.
Okay.
So let us finish here. Thank you all for giving me such a nice time. And in the next week, same day, we will be discussing the rest of the part. And if you have any questions for today, please get it written and we will discuss it in the next.
Thank you so much, sir. Actually, everyone is listening very curiously to the slides. Now it is finished, and everyone have to wait for the next class. It was wonderful session and great knowledge for us. It's very useful class even. Thank you so much for joining with us, and thank you very much on behalf of IFPH. Now we are moving to the next session. Malayalam session. Thank you, sir. Good night. Come again.
Good night.
And good night to everyone, those who are finishing with the English session. Now we are moving to the Malayalam session. I'm inviting Dr. P. Shaila for moderating Malayalam session. Dr. Shaila, please welcome.